Good day, ladies and gentlemen. This is Richard Nevins, your independent insurance agent. Just breaking down Medicare for you, and I just wanted to touch base on PPOs and HMOs. What's the difference? What's the best one for me? I'm not against or for any of them. It just depends where you live, what your needs are. That needs assessment, the initial needs assessment, is going to really let us know what's the best fit for you, because our function here is to serve you. It's not to serve the insurance companies or the carriers, but to represent what your best interests are. So let's start with PPOs. PPOs means preferred provider organization. So they prefer that you go to a certain provider within the carrier's organization, and it does give you a little bit more freedom, but as I say, freedom is not free. So if you go outside that network, the cost sharing or the co-payments will be higher. Another thing to note is that in PPOs, usually you do not have to have a primary care physician, and you do not have referrals. So you do have the opportunity to go to the doctors without going through the primary care physician, and people do enjoy that. But one thing that you have to notice is that if you do go outside the network that they do have, you will pay higher. And usually your maximum out of pockets, which is the sum of every copay you pay, can be higher outside the network than inside the network. There are certain plans that in network, the maximum out of pocket would usually be $6,000, $6,700, but outside would be $10,000 plus. If you go to a specialist within the network, it can cost you $50. If you go outside, it can cost you 20% of the cost. So, you just have to sit down and look at that and see if it fits your needs. Now, let's go to HMO. HMO means Health Maintenance Organization. A lot of people know it as Health Management Organizations, and you usually do have to have a primary care physician, and I call those the gatekeepers. They're the ones that are managing your health, and they will refer you out to your specialists. It's more restrictive. You have to stay within the network. If you go outside the network, they will not pay at all. And of course, when you go outside the network, the specialist or the doctor is going to ask for your plan information, and they're going to let you know, look, we're not taking this plan. You're going to have to pay out of pocket. Usually health maintenance organizations tend to have a richer benefit package than preferred provider organizations, because they want to incentivize you to stay within that network. And is it good or bad? Well, if you're in the DFW, health maintenance organizations are not that bad, because it has a very, very rich network. If you're in a rural area, you might want to stick to a PPO or get a supplement. It gives you a little bit more freedom. So it all depends. But the best way to be able to see if this is a good fit for you is to call in. Talk to a competent professional. Let's sit down. Let's do a needs assessment. It doesn't cost you anything. The consultation is absolutely free. Even to put it in places at no cost to you. 469-250-8621. 469-250-8621. That is our phone number. Or you can go to our website, which is rnevins.com. It says Rima Insurance. It's rnevins.com. It has a lot of information. It is a great educational resource to you. So keep these things in mind. You can go with a PPO HMO Medicare Advantage plan. You can go with a supplement, which gives you a little bit more freedom, but it's going to cost you an additional premium. Okay, so you have to keep these things in mind, guys. It's the devil's in the details, and that's why it's important to navigate this with someone who knows, someone who has the experience, and someone that's going to represent your best interests. Okay, guys, so this is Richard Nevins, just asking you to give us a call. Let us help you through this. You do not have to go through this by yourself, okay? So if you like it, just subscribe and just comment on it and share it with your friends if you feel that they have the need for this information. This is Richard Nevins, your independent insurance Medicare agent. Wishing you a great day.